how do we conceptualize racial equity?
Hmm. So I think everybody does that differently depending on their training. For me, health inequities are rooted in racism, classism, and sexism, and they're rooted in particularly structural racism that exists in the US. And oftentimes, my approaches to my research and the methodologies that I choose are, in effect, approaches that can highlight that. So, my work in maternal and child health, I use a diasporic focus. So, I look at Black maternal health um, outcomes by comparing Black people to Black people, which I did when I first started out on that. Um, I did get some pushback on why I wasn't including white birthing people in my target population in my studies. And I just go back to like methods 101, you have to include the population that aligns with your research aims. And if my aim is to determine how racism is influencing maternal health for Black birthing people, then I should solely be studying Black birthing people. And I use the diasporic focus because I actually minored in sociology while I was getting my PhD, which was intentional. A lot of people in the department minored in epidemiology to get their methodological training. And again, that interdisciplinary approach really mattered to me. So I chose sociology because I wanted a different field's perspective methodologically on that I could bring to my public health work. And that's like been vital to the work that I do now, because having that sociological approach really helped me understand the different orientations of the Black diaspora to what race is in the U.S. and what racism, this system of valuing people based on skin color is in the U.S. because we have a unique version of it here. And so methodologically, what I do is I look at the maternal health outcomes of Black Americans, African immigrants, and Caribbean immigrants, and see how they differ. And that's been done quantitatively before. And I had a little bit of literature to look at in that regard, but most of the time we compare Black birthing people to white birthing people. That's like oftentimes what we hear about. And there's less looking at what about looking within the Black population of what the differences are. And the nature of this approach, or why I decided to use this approach, was it really highlights the different exposure, the lengths of exposure to racism in the US. That's essentially what it's a proxy for. Black American people, we're talking about being exposed across generations. For Caribbean immigrants, we're talking about having more proximate exposure to the US than, say, the African immigrants just from geographic distance, but then also being exposed to slavery as well, historically, in a way that the African immigrants have not been exposed in the same way as the Caribbean and Black Americans have had in terms of the relationship to slavery. And then geographically, people who migrate from Africa are just farther away. So like we see that, Caribbean immigrants, for instance, often come to the US at a younger age, and they're often able to do more back and forth. Whereas African immigrants typically have an older age of migration, and then they often aren't able to go back and forth as much. And there's a lot done in sociological literature on the differences between all of these groups and how they, live, work, and play in the U.S. And the demographic of foreign-born Black people has just risen so much since the 80s due to, various migration policies. And in New York City, you have a high rate of Black immigrants. And I knew that from my lived experience. So I remember when I was getting my PhD, I felt very much like, well, I just keep seeing Black, white, Black, white, Black, white. But like, who's in this Black group that we're talking about? Black is not a monolith. Like, there's very heterogeneous. And I just wasn't finding that. People were talking about that as much in the public health area. But then when I go to my sociology classes, I would hear more about like, Mary Waters, Black identities. Like I would read these books that were like, yes, this is a thing. And I was like, okay, I need to marry the two and really think about, how does your Black identity, your nativity as a Black birthing person influence the way you are experiencing racism? Because this isn't a matter of are you experiencing it. I'm a firm believer in that every Black person in the U.S. is experiencing racism, whether they realize it or not, whether it's interpersonal or structural, that's, those are different conversations. But in my opinion, everybody's experiencing structural racism, but whether you recognize those moments, how you navigate those moments, how your body feels during those moments, whether your cortisol spikes in those moments, that all has actual translations to your health outcomes. And so the approach is out of, obviously intellectual curiosity, but it's also largely a methodological approach to assess how varying exposures to racism in the US results in different outcomes. And so quantitatively we find that outcomes are different between the three populations. And then I conducted a qualitative portion of the study as well to look at how these three groups talk about their Black identity, and then how they navigate perceived discrimination. So both identity discrimination. And so now this new project that I'm doing through the Health Equity Scholars for Action program with Robert Wood Johnson Foundation is investigating structural racism as opposed to just interpersonal, because I'm mainly focused on interpersonal racism before.
Okay. That was a lot. That was a lot of.
Yeah, I could talk about that for a long time. So sorry.
No. I'm glad, because I think that's a perspective that's very important, because I think often we think about data, and we think about like we hear a lot about othering data. So, for example, many times you would see Alaskan natives slash Pacific Islanders all like packaged into one group, and then, like, to your point, even when we look at Black or white or any other different race demographic, it isn't just like one monolith. And like how do we look across those differences within those groups to see how different things are impacting them, and what are those effects? Because I know that there's data out there, I want to say, for Caribbean, I think Caribbean people who migrate to the US, how they're we know, like, maternal maternal birthing crisis for Black women, for Black birthing people out here. And I've heard, or in the research, that it takes like 1 to 2 generations for those impacts to be seen in people that move across from the Caribbean. And just thinking about, like, why and like how, and then like what does that mean in a public health perspective. And I think it's also telling that you're talking about you went and did this minor in sociology while other people did epidemiology. And I think we oftentimes might lose some of the pieces of the important work of thinking about the sociological aspects of things. Public health does a good job, but sociology does a really great job of that. So I'm glad that you're able to like tie all of that into the work that you're doing.
Exactly. I agree.
And yeah, I would love to set up some more time and we could chat more about that research that you're doing there, because I think that is fascinating, and I think it's something that we don't think about or hear about enough.
I would love that. I mean, but I can talk about it all day, because a lot of people are not talking about the diaspora. I can talk about it all day.
So we'll figure something out.